This is a case of a pediatric patient with chronic recurrent headaches. We see abnormal positioning of the cerebellar tonsils in multiple planes, most evident on the right with a somewhat peg-shaped appearance, measuring up to approximately 9 millimeters below the plane of the foramen magnum. This configuration is compatible with a Chiari I malformation. Phase contrast imaging was additionally performed, although not depicted here, that dynamically showed a suggestion of mild CSF flow restriction in the posterior aspect of the foramen magnum. No syrinx formation or other cord signal abnormality was present in this case. A threshold of 5 to 6 millimeters is typically used in the assessment of abnormal tonsillar positioning below the foramen magnum. Chiari I malformation treatment practices vary, but generally speaking they are not operated on if asymptomatic, particularly in the absence of a syrinx.